wherever you are around the world. Welcome to Unheard Stories. I am Lubna Hassaniya, and I come to you from spectacular Southern California. I am very excited to introduce to you my guest, the physician, the community leader, the executive, and the educator, Dr. George Kikano. The story of Dr. Kikano is one of tragedy and triumph, loyalty and dedication. I would like to start by welcoming dignitaries sitting on the call with us. We have Councillor Mirna Khawli, former Consul General of Lebanon to LA, Councillor Ghassan Abdel Khali, former Chargé d'Affaires of Lebanon to India, Honorary Consul of Lebanon to the Greater Cleveland area, Mr. Anthony Asher. We are also honored to have with us on the call Honorable Judge James Cato and Honorable Judge Tony Raphael. Welcome to all of you. Perhaps the most critical time of life is when we transition from childhood to adulthood, when we discover that we are our own individual, separate from everyone else around us, yet we are still unsure about the world and how to interact with it. Coming of age is a momentous milestone that is riddled with so many challenges on the physical, mental, and emotional levels. Now imagine coming of age as a civil war erupts in your country, compounding your fears and your uncertainties about the world. You suddenly realize the powerlessness of the adults in your life to shield you from the atrocities of war and the difficulty for you to resolve such a reality. You are told, beware of your neighbor. Your school is no longer a place where you can feel safe, and the world no longer what your parents have painted it to be. Many find themselves trapped in the dark brushstrokes of the new painting. There are the few, however, who realize the importance of seizing that brush, dipping it deep into a vibrant determination, and drawing a bright future for themselves and for those around them. My guest today, Dr. George Kikano, is one of those few. Born and raised in war-torn Lebanon, he realized that a strong education would be his ticket to a bright future. He received his Bachelor of Science and Doctor of Medicine degrees from the AUB, the American University of Beirut. He then completed his residency in family medicine at the University Hospitals of Cleveland, Ohio. He worked with Case Western Reserve University and University Hospitals in Cleveland for 17 years before moving to Central Michigan University, CMU. He's currently a tenured professor of medicine at CMU, the vice president for health affairs, the dean of CMU College of Medicine, and the chair of the board at CMU Medical Education Partners. Dr. Kikano has served as a board member, president, or chair for numerous regional and national organizations. As a philanthropist and community leader, he drives progress on health issues and collaborations across institutions, corporations, and state agencies. We have so many questions lined up for Dr. Kikano, so let's get started. Hello, Dr. Kikano. Welcome to Unheard Stories.
Thank you for all the efforts here to highlight Lebanese individuals who are mostly immigrants to the US.
Yes.
Validates, how successful the Lebanese diaspora is in the world, and more importantly, and hopefully it gives hope to friends, families back in Lebanon.
Yes. Welcome, Dr. Kikano. We're so delighted to have you.
My family and I just welcomed our first grandchild 2 weeks ago, so I'm visiting him in Boston.
Oh, mabruk.
Mom and dad said you cannot have him on the video yet.
Yes. Well, mabruk on that. Congratulations.
Thank you.
Dr. Kikano, you grew up in Beirut. You were a young teenager when the war broke out, and it is a formidable challenge for adolescents to contend with the ugliness of war. What was it like to you back then, and what life lessons did you take away from it?
Thank you, Dr. Hassani. This is the first question, is the hardest one. It's easy for me to talk about professional career developments and others. Mm-hmm. It's hard to find a place to talk about personal questions. So if this gets emotional, excuse me. I'm probably going to spend most of the time on my first question in here.
Go ahead.
It's so, like many other people in Lebanon, you grew up in a middle-class family, well-knit family. Life is good as a child till it stops being good. And this is when the war erupted back in 1975, when I was a teenager. Mm-hmm. To put context for the first question, I was just thinking, what's the best context for this? And I found some background on Kahlil Gibran, which all of us obviously read, heard, and studied at some point in the school. Gibran, born in Mount Lebanon in the late 1800, mom and dad, multiple siblings. Back then, Lebanon was part of Syria and under the Ottoman Empire. So there was no Syria, no Lebanon, no nothing else, just a middle-class family living in Mount Lebanon. What's little known is that Gibran's great-grandfather was Muslim, at some point converted to Christianity, and his grandfather became a Christian. So for Gibran, I mean, at that point, there was no Christians or Muslims, Lebanon and Syria. It was all one in a family in a small village. If you look fast forward, I mean, 125 years later or so, the world has had 2 world wars. Potentially, you can say we're having a third one now. But Lebanon and the Middle East history, Lebanon and Syria, multiple civil wars. I mean, obviously, most of us grew in a civil war between 75 till 90. Lots of era of turmoil in Lebanon, civil unrest and economic collapse. I mean, another war in the past 2 or 3 years without bombs and shelling. So the history of Lebanon, I mean, many of us are here in the US. Australia is just because of the turmoil and the hardship. And one of Gibran's quote, which I find fascinating and very relevant to this, when he said, "You have your Lebanon and its dilemma. I have my Lebanon and its beauty. Your Lebanon is an arena from man of the West and man from the East." So, I mean, what's the foresight he had 125 years ago to figure out exactly.
Yeah.
Since your title of the talk is about unheard story, I mean, I'm going to indulge myself and just telling you some background stories growing in Lebanon. The professional one are much easier to flow for me. So I grew up in Beirut. I mean, mom and dad, 3 siblings, went to the neighborhood Catholic schools like everyone does in Beirut. My classmates growing up comes from all walks of life. I mean, you had Maroon, you had Jihad, you had Ali, you had Ahmad, you had everyone. We all took the same classes. We all took religious classes, multi-denominational, and we all attended required church services twice a week at school. None of us were conscious whether you're Syrian, Palestinian, Lebanese, Muslim, or Christian. I mean, we were kids in the classroom, middle-class family, everyone. We had more than we needed. Then the discourse changed. I was a teenager when the war started in 2015. Early in the war, I mean, like most families in Beirut, you have to leave your house, go in the foyer of the first floor, I mean, take shelter in the first floor of your building to avoid bullets and mortars. Then as things got worse, I mean, living in Beirut became more dangerous. So as a family, we have to leave our house, move with grandparents north of Lebanon, where we have uncles and aunts. And as things got worse, so you just not disrupted your education, left your house, left your comfort zone as a kid. Most important is, yes, the uncertainty and the unknown, what's going to happen to us. Then you're up 30 miles north of Beirut, you start hearing of classmates who are in their teenager, who died, who are missing, or others. Then you start losing electricity. I mean, I remember many nights, I mean, with no power, just you're living on a candle.
Yeah.
Then you have long lines for gas and fuel, and as things got worse, long lines for food and bread. Not an easy task, I mean, for a teenager.
No.
Unfortunately, same thing is happening without bombs and shelling at this point for the Lebanese. And as the war evolved, the discourse completely changed. Beirut wasn't Beirut. You had East Beirut and West Beirut. You had Muslim and Christians. You have Palestinian and Lebanese and Syrians. So the whole thing has changed in a confusing world that none of us as teenagers, as kids, as adult families were prepared for. And that I don't think Lebanon has ever been the same since. Just some personal stories of hardship, and excuse me if I get emotional here. I mean, like most Lebanese, I mean, you grew up in the city, you have a house in the village. Our house in the village happened that my father was a mayor. That house early in the war, I mean, 76 or 77, get imploded overnight.
Yeah.
We had to rebuild, and soon after it got rebuilt, became a party headquarters, one of the militia party, for 20 years. I finished medical school, immigrated to the US, could not see that house anymore, go to that village. Sorry.
It's okay.
Then I went to AUB. During my college year, I got hit by a stray bullet in my head.
Yes.
So your undergraduate get disrupted, and you have stories of your classmates getting kidnapped, getting missing, and killing. And with crossing between East and West Beirut, West to East Beirut, I remember one afternoon, I know I have some of my classmates are online watching. The bus taking people from AUB from one part of the city to the other got ambushed by a militia group. And classmates got shot, excuse me.
Yes.
So anyway, AUB is a great institution. I mean, Lebanon has great American, French institution, higher ed and healthcare in Lebanon. We're the best in the Middle East, if not in the world. In medical school, I remember my first year, we're in class one afternoon, everyone got locked in. Our president, the university president at this point, Dr. Malcolm Kerr, it happened that Steve Kerr's father got killed in his office by a militia group, an American soldier. As things progressed, I mean, for third and fourth year, as a third year medical students, I mean, you barely do anything. When you have mass casualties, when you have a mass explosion in Beirut, medical students go to the emergency room in the streets outside the emergency room dealing with casualties. Mm-hmm. You have dead people, you have people who are bleeding, you have lacerations, while the more senior students and residents are caring for the hospital, and the more senior physicians are caring for ICUs and more emergencies. So it's a great learning experience, but the trauma has long-lasting effects. So there are so many tragic stories to talk. I mean, I'm going to save you so many tragic stories, but this wasn't the case of myself. It was the case of 15 years of, I mean, these are two generations affected by the civil war. For most Lebanese, education was no longer an end by itself, but it was more of a ticket or a visa to escape the atrocities of the war and leave. Yeah. But we all heard that old quote. So it doesn't matter how many times you fall. What matters most is your ability to stand up and keep moving. So this is now, I'm not going to talk about resilience or others. Everyone's thinking about talking about resilience. Then during my medical school, met my wife, Mona, immigrated to the US, have two beautiful children, grew up in Cleveland. They're both married, successful, and we welcomed David George 2 weeks ago.
Yes, talk about determination and resilience, Dr. Kikano. I was there during that horrendous era in Lebanon's history. I know exactly what you're talking about. And the enduring effects of war are undeniable. Those of us who were spared death were not necessarily spared injury. And even years later, PTSD would surface for many, fear, anxiety, and depression. Dr. Kikano, what goes through your mind today when you see the horrific imagery from Ukraine on TV?
Thank you, Ozzy. Like you said, Dr. Hassaniya, the simpler answer is flashbacks and PTSD. Yeah. Mm-hmm. If you look, I mean, for people, if you read a newspaper, you watch TV, you see bodies in the street, you see damaged building, mass destruction. This is where most of us during the Civil War grew up in Lebanon. So this is TV or picture, these are in Ukraine, are flashbacks to Lebanon during Civil War.
Yes.
I mean, I was fortunate early in my career back in the 90s, I had some assignment to work in Ukraine. It's a beautiful country. So I was fortunate, I mean, after the breakdown of the Soviet Union, I was able to set up primary care clinic and do some outreach program in Lviv. I mean, Lviv is known as the city of cathedrals, beautiful city. But since this is unheard stories in Ukraine, what's unheard is, I mean, throughout the globe, when you have wars, is the emotional and psychological damages on families and children. So outside the destruction, the casualties, the disruption of education, of trauma cannot be quantified by measured by numbers or dollars in here.
Yes.
So before the Ukraine war broke, the UNHCR, United Nations High Commission on Refugees, were 40 million refugees in the world.
Yeah.
This is twice the population of California. Yeah. In the past 10 weeks, we added 5 million Ukrainian refugees. So you have 5 million people, all women and children, because men are not allowed to leave, are refugees in Ukraine, inside or outside the Ukraine. So the hardship on these mom and children is going to go for generation. This is what people don't talk about. There are so many unheard stories affecting generation because of what's happened in the past 10 weeks here.
Yes, definitely. And this imagery, like you said, is traumatizing and brings back, memories. But I think it is essential to have access to it, and so the world can process and evaluate. Some people don't know what war is. Every grieving mother deserves to be heard on top of that, and every orphan, absolutely. Dr. Kikano, I won't ask you why you left Lebanon, but how did you end up in the United States, and why Ohio?
Yeah, okay, everyone, none of us, whether in the US, where you are in Ukraine and Lebanon and Middle East, no one makes it in life alone. We all, grew up in families, someone helped, family unit, or at some point professionally, all of us had the helping hand, had a mentor at some point, or a bridge to get us to a new destination. So all of you on the call, as much, karma comes back. What you do in life is gonna come back. After graduation from AUB, I was fortunate, to be connected with a friend of me, now a friend, Dr. Sami Harik, who was a famous neurologist, educator, and researcher at Case Western Reserve. I was given the opportunity to work in his lab for a year before I got my exams ready to apply for residency program. And as you mentioned earlier, I mentioned family medicine in the same place in Cleveland. Cleveland became home for myself and my family, where my kids are born and raised. And as an international medical student, to be able to get a residency program in the United States, you have to go through something called ECFMG. I'll mention that later. It's a big monster for us medical students. You have to be ECFMG certified to be able to train in the US. Fast forward, I'll mention that, 30 plus years later now, I am on the board of ECFMG, which is a big task I'm so thrilled about. I had 25 years, great 25 years in Cleveland, lots of opportunities and many positions there.
Yes. And you were there from 1988 to 2015 at Case Western Reserve University and university hospitals. Can you walk us through your career development? How did it develop from 1988 to 2015 during that, your stay there?
Cleveland has many outstanding higher ed institutions. Case Western Reserve is outstanding. You have big hospitals. It's a mecca of healthcare and education. So there are many opportunities for someone to advance their career. And Cleveland's happened to be a large Lebanese community too. It has lots of Lebanese, Syrian, Palestinian from the Middle East. So in the culture and the opportunity for higher ed, Cleveland is an amazing place to be. It's a rich environment where, I was fortunate to have great mentors coupled with the curiosity to keep learning. I went to school after during my residency too, working hard, and they're all recipes for good success. Early in my career, right after residency, I was given administrative responsibilities, more challenges. I didn't have an instruction manual, but I had a great mentor. I was given space to make mistakes that made me better and helped me grow. I became a full professor at Case Western Reserve like 2 months after my 40th birthday, and I was given the opportunity to chair one of the top 10 departments of family medicine at that point. So being 40, being a full professor and chairing a department was a great opportunity. It wasn't just my skills, it was people who trusted and invested in me.
Yes.
From there on, life goes on. I was chief medical officer for one of our hospitals, became medical director for one of the largest home care agency in Ohio, was medical director of a hospice program, and I started a new one myself. And for 2 or 3 years before I left Cleveland, I was vice dean for community health at the Case Western Reserve School of Medicine. Over the years, I interacted with thousands of medical students and residents. Many of them are in leadership positions through the country. So I was given lots of room to grow, to make mistakes, stand up and learn and keep moving here. So I was fortunate. I had a great career in Cleveland, raised my family there, and I lots of Lebanese friends, obviously. And I see Mr. Tony Asher here, who was on your show last year. Tony's a very close friend and an outstanding mentor for me. Thank you, Tony.
Yes. Well, that's a remarkable journey, Dr. Kikano. If the COVID pandemic taught us anything, it's that the world is becoming one big community and that our individual wellness does not exist in a vacuum. So improving the health of a community helps us avoid complex problems down the road. But still today, and according to the American Public Health Association, average lifespans of the members of a community can differ by 20 to 30 years due to lack of access to affordable healthcare, healthy diet, mental health support, and so on. While you were still in Cleveland, you developed healthcare programs to support the well-being of your community. Can you share with us what you did there?
This is, the opportunity to have titles, to be in position to be able to impact the community is a dream, is a lifetime dream here. As a country in the US, we spend 20% of our GDP on healthcare. So 20 cents of every dollar we spend as a country goes in healthcare, yet. So we spend more on healthcare than we spend on education, than in defense and investment in jobs. Yet, if you look at it one patient at a time, this is the best care in the world, no questions about it.
Okay.
If you look at it from a public health perspective, we are one of the worst countries in the world among developed countries for healthcare outcomes. So you're spending 20% of your dollars on healthcare, but your outcomes from the public health are one of the lowest in the country. So the disconnect is there. Like you mentioned, Dr. Hassani, within 10-mile radius in any community, Chicago, New York, Boston, LA, San Francisco, or others, you have up to 20 years of difference in lifespan in a 10-mile radius.
Wow.
Infant and maternal mortality among the underserved among us is 3 times higher if you're a poor woman or a woman of color compared to another. This is getting care by the same physicians at the same hospitals. Yes. So the disconnect, because what we do as an individual versus a community is big.
Yes.
So trying to and like politics, healthcare or community health, is local. Community needs are specific. So trying to identify what the community needs, develop and implement plans to affect the communities is an amazing experience. And you can do it in every community, rural and urban. I've done it in Cleveland. I'm doing the same where I am in Michigan. But I would like to take the time just to highlight one program here, which is can be the signature of my career actually, and ties into funding in your next question.
Okay.
So in healthcare, there are people that we refer to as frequent flyers or dually eligible. I'll mention that. So the dually eligible are senior people. So these are people on Medicare. They're poor, they're in Medicaid. So they have federal programs, they have state programs. This is where the dually eligible comes from. Every community has them, and they account for one of the largest chunk of our healthcare spending. In healthcare, we call them frequent flyers. Even though they have the best insurance, they have 0 deductibles, so insurance is not an issue. They can access any healthcare system, any clinic in town, in any community, yet their care is at the wrong place at the wrong time. They end up so many times in the emergency room because they don't have access to their physician in a timely way. They end up in the hospital because transportation issues, because their medications are messed up. So you get the context of it. And they're spending on healthcare. This is taxpayers' dollars at the federal and the state level is huge. So at some point in Cleveland, which is the mecca of healthcare, within one city block, you have over 2,000 hospital beds. Care is amazing. Access is a challenge. So I figured out, these individuals in February in Cleveland, they're taking 1 or 2 buses to come for a half-an-hour appointment. It doesn't work. They miss the bus. They have to work from the bus stop to the hospital. It doesn't work. Started with a $50,000 grant from a local foundation. Come to find out, you have over 4,000 individuals who are dually eligible within 5 miles of two major national hospitals. So what we did, developed a team where we took the care from the office or the hospital to the people's home. And then granted, the neighborhoods are not that safe. But so taking that care to them these are not physician-led, these are physicians, mid-levels, nurses, social workers, coordinator, and we cluster the visits in a way to make it efficient.
Okay.
So the care we provided was, we had a fancy black bag. Safety was not an issue. Be concerned from the outside. I mean, at that time I had a fancy car. My nurses are going on their own, I mean, to neighborhoods that are not that safe. We never had a single safety incident. People in the neighborhood knew the doctor, the nurse, the social worker is coming to see our neighbors. So safety was not an issue ever.
Mm-hmm.
The ability to do procedures at home, to give vaccines, the ability to do med reconciliation. I have so many stories to tell. So I can spend an hour just telling you stories about experience in house calls. Just to give you one time, I mean, I went in to see that lady in a high-rise building, crime scene, I mean, drugs, crime, and the whole thing. Elderly person, her smoke alarm was buzzing. She couldn't, hard of hearing, she couldn't hear it. I got up on a chair and took a 9-volt battery, drove to the neighborhood store, changed her battery.
Yeah.
So the stories we can tell you about what we've done in the neighborhood in Cleveland.
Yes.
Are amazing. I mean, this is for another discussion. So
yes.
This has been the highlight of my career.
Yes, that's excellent, Dr. Kikano. To be so connected with the community is a must. How do you measure? I mean, when do you start seeing the effect of this, of in-home healthcare?
So this is where you measure outcomes. For anything you do, you have to evaluate. I mean, what's working, what's not, and not everything is a success. You're going to have as many failures as successes. Measuring outcome, readjusting your business plan, readjusting your vision is important. Mm-hmm. And support for these programs is key.
Yes.
So when you talk about support and philanthropy, the first place people go to is individual philanthropy, people with money. To be able to cultivate individuals with resources who are willing to give, you have be humble, be trustworthy, develop these programs, implement them, measure, and tell a story. People who have, I mean, unless you win the lottery, people have resources, people are philanthropic.
Yeah.
Smart people, they've been through life. I mean, small businesses, large businesses, you have to demonstrate results. And so measuring and demonstrating results. Same thing, I mean, cultivating, relationship with foundations is important, and figure out how does your program fit with the foundation. But for the house calls, for example, I mean, we're doing this in one neighborhood called East Cleveland. A major philanthropist, big successful person in the Cleveland area. Well said, Dr. Kikano. I mean, my parents were East European immigrants. He has a foundation. The neighborhood where my parents immigrated to has been medically underserved. What would it take? And this, I mean, Mr. Asher was a big part of this. What would it take to duplicate the program in the Slavic village? So what we did, we developed a team similar to what we've done in East Cleveland, funded by this individual and his foundation. And we started the house calls in the different neighborhood. One other philanthropist, I mean, I was doing a house calls on someone with resources one evening at the dinner table. I mean, he looked at his wife, he said, you know what? I remember having the physician come to the horse to my parents' farm. I'm glad Dr. Kikano is doing this. This ended up in an endowed share for $1.5 million in house calls.
Oh, great.
So philanthropy can come from foundation individuals, but you need to start somewhere.
Yes.
But the other piece of philanthropy, if I may, Dr. Hassaniye,
yes, go ahead,
are actually government and policymakers. Just for house calls specifically, it's HUD, which is Housing and Urban Development. We were able to leverage $2 million to do home remodeling. So I'm a physician. I mean, I'm not a contractor. I know nothing about real estate. We were able to get $2 million from the federal HUD to do remodeling. Remodeling meaning put safety ramps. I mean, on people's home who are dually eligible. I mean, look at the avoidance of emergency room visits, avoidance of broken hips and knees and others.
Yes,
put grab bars in the showers, bought AC units for inner city homes. So elderly individuals with emphysema, with asthma, with lung conditions, they're not ending up in the emergency room. So the cost saving for this, the ROI, and this was the HUD measure. At some point, we got invited actually to the White House, part of a larger senior group, and ultimately CMS, which is Medicare, They changed their rules now, they cover for households.
Yes.
So you have individual philanthropy, you have foundation philanthropy, you have federal grant that support this program, and the policy piece, the Medicare now pays for households. So the ultimate, you start with a mission, you start by doing what's good for the people, and you have no idea where this is going to end you. And we figure out what the business model now is. The model we developed for households is financially sustainable now.
Nice.
And so the policy piece of it now, it's nationwide, nationally, households are covered.
Yeah, that's great. That's great news, Dr. Kikano. Thank you for all that hard work you put into it. In 2015, you had a shift in your career. You became the Dean of Central Michigan University College of Medicine. You left Cleveland. Can you give us some historical background on the College of Medicine at CMU and explain how your unique vision led to where it is today?
I think as a country, we're facing a shortage of 90,000 physicians over the next 10 years.
Yes.
And medical schooling with residency takes usually 10 to 12 years. So when I talk to individuals in Michigan or others, so the crisis for tomorrow started now. So the ability to just put things in context, for 50 plus years, Michigan had 3 medical schools. That number doubled in the past 10 years. Okay. So the ability for someone's career to start a brand new medical school, brand new medical school with a vision to serve the underserved, it's a lifetime opportunity. So the building piece of it, as opposed to maintaining, moving to an executive role, being a boss and having corner office, there's nothing exciting about it.
Yeah.
The ability to build, so the ability to recruit amazing faculty and staff, which I work every day. Actually, they do the hard work, I do the easy work. They make my job easy. So build a great team to be able to select students. For next year's class, we're starting in August. We have 8,000 US applicants for the 100 positions. 8,000 US applicants. So we recruit for the mission. We recruit students who are well-rounded. I tell them they have a high EQ, but the EQ is more developed than RQ. So the ability to build is a lifetime dream. And the past few years, we got fully accredited. We're going for second accreditation. We are building we're building research now. More importantly, we are going to be affecting the communities we serve in Michigan.
Yeah.
So having a job that pays you a good salary, working with a team every day that makes your job easy, and interacting with students with a mission, has been a lifetime dream here.
Yes, and impacting your community. It's amazing. Your success story with CMU's College of Medicine is a testament to a vision focused on service, Dr. Kikano, and keen on delivering results. I want to mention here that you are also a board member of the Council of Deans of the Association of American Medical Colleges. Congratulations on the appointment.
Thank you.
Dr. Kikano, you spoke a little bit about the socioeconomic and cultural backgrounds and their effect on the well-being of a community. You are a founding member of an innovative regional collaboration focused on economic development and on improving healthcare called Thrive. Can you tell us about this initiative? How far-reaching is it? And what organizations are partnering up with you on this one?
Thank you, Dr. Hassani. You think that people would have thought about this 10 years ago, 25 years ago, 50 years ago? I don't know why it hasn't happened. Just the marriage or the combination of healthcare at the community level and economic development. 20% of your GDP, we never think it has any economic ties. Well, Michigan Health Improvement Alliance is what we call a backbone organization taking care of community in 14 rural counties in Michigan. That's what we call a backbone organization. I'm fortunate enough to be the vice chair of the board of Mahaya. At the same time, I'm the board member of something called Great Lakes Bay Regional Alliance, which is in charge of getting businesses, making jobs. So the two organizations came together, literally over a coffee and some breakfast years ago, where how can we tie healthcare to economic development? We developed a program that we branded as Thrive, transforming health regionally in a vibrant economy. So using healthcare at the macro level, rural communities to create job. So we started with a consultant that gave us a detailed analysis of opportunities and gaps in our region, very specific. Then we built programs and we narrowed down 2 priorities. And our first impact report from Thrive got published literally a week ago. This is a project that, to my surprise, was never done. Tying economic development to a healthcare at the macro level for communities was never done in the country. Please email me, send me a text, or just go on the website for LinkedIn for Thrive. Look at that economic report.
Yes.
That project has been highlighted in the Surgeon General annual report last year as a model project for the country.
Congratulations.
And hope we can scale it.
Yes. Yes. Well, that's a testament to your clear vision and imagination to make a difference. Dr. Kikano, in addition to the remarkable work you do with the healthcare programs and initiatives, you are also a practicing family physician and advocate for care for the underprivileged in 2 different states. What motivates such an altruistic act? How can you do it in 2 different states?
I went to school to be a physician, no intention being an executor or an educator or others. And this is the core. This is the core of who I am. I'm a physician at core, and we've all heard that saying. If you do what you love, you never have to work the rest of your life. So the flame here is just being a doc. I trained to be a family doc so I can take care more comprehensively of people.
Yes.
It's more the breadth actually on the foundation of depth. So I take care of both physical, behavioral aspects, and my practice mostly in Cleveland at this point. I have two or three generation family that I've started taking care of them 30 years ago. I'm seeing grandkids now. The privilege to be able to work with families over generation, providing comprehensive care. After 2 or 3 years after I left to Michigan, I'm still taking care of my patients in Cleveland without a practice on text messages, iPhone or other. So I went back to Cleveland. I go back now. I see my patients, and I establish a small practice in Michigan. And you never know when these skills come handy. 3 years ago, around this time, the Great Lakes Bay in Michigan, we have 2 dams that broke. So 2 major lakes broke in a span of 12 hours, thousands of people displaced. Yeah. So literally on the same day, my nurse practitioner, Anne-Marie Wiggins, said, well, Dr. Kikano, we need to help. So we pulled our students from the hospitals in rotation. We staffed a high school. We made it up a shelter. So you had pregnant women who are displaced. You have seniors displaced without medication. So we pulled the students. What a great experience for them. We made up shelter in an emergency, and we staffed it for a few days till people get displaced. And again, the testament of basically education, clinical services, and a very generous community. Yes. The community where the flood happened. You had lines of people. Yeah. Dropping foods and everything else.
Yes, and you're there to drive everything and make it happen.
This is the one most rewarding, applying your skills there while you have learners with you and work with a great team and impacting communities during a crisis.
Thank you. Thank you so much for that. Dr. Kikano, you were recently elected to the Board of Trustees of the Educational Commission for Foreign Graduates, ECFMG, and the Foundation for Advancements of International Medical Education and Research. Can you please define what these 2 organizations are and tell us what mission you will be on with this appointment?
So again, as a country in the US, 25% of our physician workforce, these are practicing physicians in the country, 1 out of 4 have an accent. Someone like me who went to international medical school. So the access point for international medical graduate or foreign medical graduates to get certified, to get trained, to be able to come to the US, get a visa, something called ECFMG. So as a student, this was a big monster. ECFMG is something scary, but this is the ticket to come to the US. The second organization is called FAIMER, which is a newer organization trying to advance healthcare education and research worldwide. So I'm a ECFMG certified. I'm the recipient of their certificate from over 30 years ago. The ability to go back and serve as a board member, to impact policies, to impact decision-making for international medical graduates, one on one side, help them train in this country, and advance medical education and research worldwide as a board member. I just got to my first board meeting. Actually, that board has 2 other Lebanese individuals, which is amazing.
That's good.
So, I mean, one of the discussion at the last board meeting, I mean, what do you do with medical students in Russia and Ukraine impacted by the war? So the ability to have that discussions, make decisions, and affect policy is going to be a good ride over the next 4 years.
Yes, that's the beauty of it. You can affect people's lives positively and help in every way you can. Thank you for that. With all the initiatives, Dr. Kikano, in community healthcare that are you're spearheading, you are looking to hire professionals to different programs. What kind of positions are you looking to fill, and what credentials are you looking for?
I mean, as I mentioned earlier, I mean, we are facing a major shortage of physicians. So the ability, I mean, people who are board certified, people in Lebanon or others who can have access, ECFMG certified. I mean, this country is facing a significant shortage of nurses, psychologists. So healthcare jobs are the #1 needed jobs if you look at the Department of Labor and Stat, between now and 2040, the #1 jobs we needed are healthcare related. It doesn't have to be physician. So people who obviously, I mean, language is an issue. The people who have the credential or can seek the credential or get retraining in here, there are going to be plenty of healthcare jobs in the country.
Okay.
Unfortunately, forced migration happened with the economic collapse in Lebanon. Unfortunate for Lebanon, but fortunate for the individuals. I was able, I mean, over the past few years to get outstanding people. I mean, many people, some of them came with younger kids and the families. So with established career, I mean, I know some of them are on this webinar this morning, established careers, I mean, professionals, then you get uprooted, come find a house, try to figure out how to get a mortgage, put your kids in school. Yeah. Again, it speaks up to the hardships in there, but given the opportunity, and they're all successful here.
Definitely.
All of us, I mean, the Lebanese diaspora, physicians, nurses, AUB graduates, USC graduates, to the extent you can help, giving a hand to individuals who qualify to come here at all levels. There are plenty of opportunities. Healthcare jobs are abundant.
Yes.
It's unfortunate for Lebanon, but we cannot impact the situation over there.
Yeah, definitely. You do what you can over here. And to add to that, can you sponsor a visa application should a good candidate need it?
Actually, there are many pockets in the country, what we call HIPSA, health professional shortage areas. So based on your designation, yes, you can sponsor a visa. You have to demonstrate that there's a need in that community. I tried to get that physician, that PhD, that nurse, but there's no US qualified candidates to do it in healthcare. The answer is yes. Or people who has at a more senior level, there's something called O visa, which is outstanding ability, or obviously student visas are abundant. So if you're an established professional, you have the credentials to be here. There are many ways to get here.
Yes.
It's not just for physicians, as I mentioned. It's for others seeking education in here to complete a PhD degree or go to undergraduate level. So with the right, or you're a senior person where no visa. One of my colleagues who came from AUB last year, and we were in discussion with someone to come for a sabbatical for a year. So there are some temporary measures we can do, or some obviously immigration measures that we have to go with the regs and rules.
And what helps, like you said, the need is high right now for that kind of positions. Those positions.
The other outside, Dr. Hassani, outside extending a hand for people who are in crisis in Lebanon, these people once established in here, they can go back and have families. They can help financially. They can help with medicine. They can help with others.
Oh, yes.
So from this side, I mean, for years I've been saying, I mean, as Lebanese immigrant, we can help from the outside, then we can help from the inside there.
Thank you. Thank you for that. Well, Dr. Kikano, thank you for all the positive energy you put out there to help elevate your community and serve the underserved. And thank you for taking my questions. Let's open the floor for the audience to see who has a question for you. For those who wish to ask Dr. Kikano a question, please leave it in the chat box or raise your hand using the reactions button on the bottom of the screen. Let me see what we have here for you. Mona Jarudi is saying, love your profile picture. Good evening from Beirut. Thank you, Mona. Thank you so much. Dr. Kikano, I want to ask you how is technology reshaping healthcare, in your opinion? Is it putting patients at the center of care, or is it mainly benefiting hospitals and pharmaceutical companies?
Technology is amazing. I mean, healthcare was behind. I think we're catching up now with the epidemic. We're forced to catch up. Look what we're doing. I mean, you have people from Lebanon, I'm sure here. You might have people from Canada, the US, or others. Look at what's happening. Same thing is happening now, what we call both synchronous and asynchronous healthcare. So synchronous, you can do house call visits, I mean, with a patient online. You can look at body languages. Actually, we just unfortunately, we just got a 7-figure grant from the government to establish a telepsych unit in 2 rural areas in Michigan. So the ability, so there are major shortage of psychiatrists. I mean, the average wait time is 6 months. We just get approved for a 7-figure grant to put the infrastructure so we can provide a reach out to the community.
Yes.
I mean, again, this is filling a gap. You have monitors that happen in people's home at this point. We can have just in the back of your iPhone, you can get a tracing of an EKG, you can get your pulse ox checked, so technology is, it's a game changer.
Yeah.
And it's improving the health for both, urban and rural communities. Okay. So both the monitoring piece, the delivery, actually as a medical school, we rely on volunteer teachers. We had a grant from the Department of Agriculture where we equipped our teaching physicians in rural area to be able to connect remotely for lecture for our students. So we're doing this for both education and healthcare, and we have not yet scratched the surface.
Yeah, much more to be done. I'm going to ask Dr. Omar Muhtar, to go ahead and ask his question. Can you unmute yourself, Omar? Yes, go ahead.
Thank you, Dr. Kikano, thank you so much for sharing your story. Both your background as what drove you to become a physician, and also proving the one quality about Lebanese people, which is no matter what happens to us, nothing can stop us from achieving our dreams, it seems like. My question to you is about Thrive Healthcare. I too also I'm starting a company trying to also improve patient outcomes by working in the provider office. And much like you, I'm also trying to scale and having that as an issue. I'm using technology to help address that. My question to you is about, when it comes to economic development and community outreach, what were like the metrics you were using to measure the efficiency, to know what you needed to improve, to know when you need to increase basically like labor, or you needed more manpower at this source, or divert resources? What did you use to help you understand that?
So as I mentioned earlier, so the Department of Labor and Stat had federal measures, but they also have them by census tract. They have them by state, by census tract, what jobs are needed, projected for the future. So, every community has Chamber of Commerce or economic development units. So working with them to figure out what they've done at the state level or at the local community level can be early measures. Early in the Thrive building phase, this was 4 years ago or so, we hired a consultant company that did the environmental assessment of what's happening in the whole region. And they interviewed every kind of stakeholders. These are hospitals, small businesses, private businesses, corporate, a large publicly traded company. So they did interviews, very structured interviews, tied them with data, and they have a whole detailed book and tell you about graduation rates for students in the K through 12. Available jobs in R&D, available jobs in research. So we developed a guidebook specific to the region based on public data, as well as targeted interviews from community members from all walks of life. This is corporate as well as grassroots. That helped us focus. So we came up with 37 priorities, clustered them into six priority area. So this was our decision. Again, these are local decisions to each community. But the model, what's interesting here, Omar, would be scaling the model we developed.
Thank you. Thank you for answering the question, Dr. Kikano. We have a note left for you here by Rob Valentine. He's saying George is a caring doctor, friend, and a community leader for our entire community. He has touched so many people's lives, not only at CMU, but also across our community and around the world. George drives collaboration. Thank you, Rob.
Thank you, Rob.
Yes, and Omar is thanking you also. Dr. Kikano, the pandemic caused a shift to a more decentralized digital operation, which gave rise to virtual healthcare. What benefits or problems are virtual platforms creating for healthcare, and how do you see the change down the road?
So, I mean, that change is permanent. I mean, the world has changed post-pandemic. I mean, whether running business meetings or delivering care, I mean, there's no going back to where we were before. I mean, education is happening now in a hybrid model. I mean, some classes, I mean, in higher ed are in person, some other are hybrid. Same thing is going to happen to healthcare. The ability to get a consultation, I mean, remotely, again, with the shortage of physicians, the opportunity to access subspecialists at large healthcare centers, the ability to do monitoring of individuals at home. I mean, you have monitors now for elderly who are falling. You can monitor their oxygen. You can monitor compliance with taking their medication. So the application of healthcare in the home, this is what the new word is. I mean, so healthcare is not going to happen. I mean, hospitals should become all ICUs.
Yeah.
Medical services should become outpatient. Look what happened just in surgeries over the past 25 years. You used to be admitted for a hernia surgery for 3 or 4 days. Same thing for cataract.
Yeah.
Now you're having your hip replaced in the morning. You're walking out of the hospital.
So true. So true.
And, so everything is going to shift. It shifted outpatient. It's going to shift to the patient's home now or to the patient's community. And hospitals will become ICU. So the hospital care is going to be very intensive, quaternary. Everything else will be shifting at the community level.
Yeah.
At the backbone, the spine of all this is going to be technology.
Yeah. Yeah. That's a good vision. That's a good vision. Thank you. Our former Consul General to LA, Honorable Mirna Khawli, just said, thank you for an interesting story for another successful Lebanese abroad. Thank you. Thank you. Dr. Kikano, we're going to have to end the session here. Thank you again for sharing your inspiring and motivating story with us.
Thank you for the opportunity, Dr. Hassaniye. Wishing you the best, and we can do it as Lebanese.
Yes, definitely. Together we can. Today's event will be uploaded to YouTube and shared with all of you, along with a link to subscribe to get my future invitations. Unheard Stories is a monthly event. It falls on the last Saturday of every month. You don't want to miss next month's conversation, which will be on Saturday, May 28th. My guest will be Mr. Dalton Einhorn, the editor of an ongoing series of books emerging from the largest known collection of unpublished Gibran Kahlil Gibran materials in the world, the Mary Elizabeth Haskell papers at the University of North Carolina. You will learn why Mr. Einhorn was granted an exclusive license to publish from the archived material and his relationship to Miss Virginia Hello, the first and only person authorized to have access to the archives. Mr. Einhorn will be unveiling for us the unknown real story behind the creation of the 20th century best-selling book, The Prophet. His book, And the Prophet Said, was released in 2020 and contains over 150 newly discovered poems and aphorisms. In 2023, Mr. Einhorn will be publishing The Birth of the Prophet, Gibran and Mary's creation story in their words, just in time for the Centennial Anniversary of the masterpiece. Mr. Einhorn's information is invaluable. It will allow us to delve deeper into the life of Gibran to better understand the artist, the poet, and the writer. You definitely don't want to miss it. So don't forget to register. To watch past events and know about our future ones, you can follow me on social media. Thank you all for bringing us into your home and making us part of your Saturday. Goodbye, everyone. Thank you, Dr. Kikano.
Thank you, Dr. Hassaniye.